So without further ado, I'm going to share my presentation. So I'm currently at the Centre de Formation Médicale as a postdoctoral researcher, as well as an adjunct professor there. So again, the first part of the presentation will just be a brief overview of some of the health impacts of air pollution in general, air quality regulations, and then we're going to be talking about what I actually studied, which was air pollution and how it relates to ALS in New Brunswick. So first of all, at least to me, I find it's unfortunately no surprise. Air pollution is the leading contributor to the global disease burden, at least as of a study that looked at in 2021, up to 8% of the total disability adjusted life years. It might seem heavy at first, but then you have to think that air pollution not only causes heart disease, stroke, lung cancer, it also affects premature death. And there's a bunch of other immunological processes that just makes it that people are just more susceptible to have things go wrong with them later on in life. It's very much a cumulative damage model. Based on population data for 2016, it seems that, as you can imagine, ambient concentrations for fine particulate matter, nitrogen dioxide, and ozone, in particular, that leads to potentially 15,300 premature deaths per year just for background air pollution in Canada alone. Based on a Health Canada report in 2021, and I do have my references at the end, I'm more than happy to share the PDF version of this presentation at the end. They estimate these premature deaths, in addition to the burden on the healthcare system, could be as much as $120 billion, approximately 6% of Canada's real gross domestic product. In New Brunswick alone, seeing as there's 190 premature deaths per year, which makes up the bulk of causes, because premature death also means loss economic value. There's obviously evidently all the fact that increased disease is putting an additional strain on our retirement home and overburdened hospitals. The cost quickly balloons to an estimate of potentially as much as 1.4 billion. As it relates to trying to reduce this, the World Health Organization does have some standards that they did systematic reviews of the literature to kind of help with the experts design some guideline values that we should aim to be under. These global air quality guidelines, it should be noted though that while they do reflect the growing body of evidence, it does keep on suggesting each time we lower these levels that if we go even lower, it seems that there's still damage. So in other words, it's almost kind of like, we lower the levels, the world tries to lower them. We're then able to do a new study at these lower levels, and we're still finding that there's health burden being caused. There is separate Canadian air quality standards in addition to the WHO standards that are specific to our geographic and cultural considerations. Do note that because they're based on that, it does ensure a certain feasibility of achieving them, which will help for actually, attain them in a continuous manner. But note that it's still just used for generally assessing long-term air quality management. And we'll get to that after where there might be a need for more stricter considerations. So enough about background about what's in the literature. I think it's more important that we look at, what was investigated here, at least relative to me, in our own backyard here in New Brunswick. So for those that don't already know, amyotrophic lateral sclerosis, so we take its Latin word for word, it would be simply a morbid hardening of the nerve cells in the spinal cord that results in muscular atrophy. So as you can see by the image, we have an individual that has healthy motor neurons. We got lots of synapse here, good myelins. The signal is getting across very easily. However, as motor neurons begin to deteriorate in this disease, all of a sudden we're having less the ability to have control over voluntary muscles, which eventually leads to progressive paralysis. So usually at what we'll consider disease onset, symptoms tend to kind of go into like two clinical presentations at the beginning, whether it be more like a spinal form with some muscle weakness, maybe we're kind of tripping over ourselves, all of a sudden walking distance may be impaired, Whereas on bulbar, for those that are up to snuff with their neurological pathways, would be dealing more with slurred speech or even certain difficulties with swallowing that tend to be the first symptoms. But over time, it tends to blur, and usually towards the middle end of the disease, it's kind of a cluster of all these symptoms. There's approximately 2,500 to 3,000 people living with ALS in Canada by our best estimates. And unfortunately, most will die within 3 to 5 years of the onset of symptoms, often due to respiratory insufficiency, as it slowly becomes difficult, basically impossible to breathe. So, at least here in New Brunswick, shortly after diagnosis, our clinicians often get asked this question. There seems to be a lot of ALS in New Brunswick. And the only counter we had is really, well, is there really? And the reason we mention that is evidently, maybe, ALS community being as tight-knit as is, maybe just everyone happens to know everyone who's living with the disease. So to kind of address it more objectively, Dr. Colleen O'Connell at the Stan Cassidy Center is in charge of the provincial ALS clinic, and her team. They did a preliminary spatial analysis of the incidence of ALS across New Brunswick between 2003 to 2013. And there was actually 2.5 cases per 100,000, where usually ALS, we kind of see it more in the realm of 1.5 to like 2.1 cases per 100,000. There's questions, obviously, when you deal, especially with an Acadian population, about certain founder effects. However, it would appear, to the best of our knowledge, 92% of cases were considered sporadic with no known familial history. And probably the most damning thing of all was it wasn't just that seemed to be more cases in general. It was that the cases seemed to cluster in regions. So areas with excessive numbers of cases. And you can see here by the image on the left, this is Bathurst, Bathurst, so like kind of like the greater Bathurst region. And each of those little markers is actually a separate ALS case. So I don't know about you, but Bathurst, even if you consider the greater area, and we're dealing with maybe 10,000 people max, even over a 10-year period, for 2.5 cases per 100,000, I don't think we should be able to do door-to-door clinical rotations whenever we visit these areas. That's just way too many cases. And there was also a cluster in Edmundston, St. Paul Parish, and Wilmot that was identified. So right here, that is a strong potential highlight that environmental influence may be involved in the development of ALS. So another question people living with ALS often ask our clinicians shortly after their diagnosis is, well, what's causing this? Which is a very valid question. We all wonder, was it something we did? Bad luck? What's going on? Unfortunately, it's as simple at the moment as it's complex. We don't know what's going on. So the cause of ALS is unknown. Most cases are considered sporadic, 90% where it's just like it's an unknown. And even when we have a familial versus a sporadic case, there's actually the same genetic mutations that can be found in both subpopulations. So this even hints even harder that maybe this disease is actually the proper term complex, where it's not just genetics, but also small contributions from various genetic insults with various environmental factors playing together that lead ultimately to a neurodegenerative process of ALS. Interestingly enough, we also looked at the Canadian Neuromuscular Disease Registry for a prospective study for people living with ALS, and it looks like they're indeed extremely interested by the epidemiology of ALS. And I was lucky enough to be able to do some rotations with Colleen at the clinic, lucky enough to eavesdrop on them. And it seemed like every ALS person living with ALS and their families had a different hypothesis about something in the province causing their disease. Whether, knowing many truck drivers, people that work on rails, old mines and abandoned mills in their community. All things with, interestingly enough, kind of heavy hit on all a common emission. So we'll get to that later. And we also had a patient partner, Troy Ackerley, that followed us the whole way through until his unfortunate departure, which was very useful for ensuring the study sticked to the original question these patients asked. We quickly did a systematic review as well to see if there's anything that's already been studied. And specifically for air pollution, there's only been 9 studies across the world that seem to have been done at the time of the systematic review. 3 case control studies on diesel exhaust exposure being related to disease. 3 case control studies on nitrogen dioxide levels, and this a dose response. So as you get more NO2, the chance of developing ALS, it just gets worse and worse and worse. However, while there was geospatial measurements, none of these studies looked at sulfur dioxide, which is often also released alongside diesel exhaust exposure, among other combustion activities. And there's no ALS environmental studies that have been done in Canada yet. So this would actually be the first. We decided to go to the route of a matched case control study. This is basically the gold standard we can strive for because a cohort study with such a rare disease is just logistically speaking not doable. And a randomized controlled trial involving air pollution just is not ethically reasonable either, with good reason. So a matched case control study, what we did was we have our 304 cases we were able to identify from the Stan Cassidy Center, which were identified by reading, well, as you can imagine, pretty well every single medical chart and identifying them all. That was a tedious months of digging. And this allowed us to then graciously have an access to their Medicare number as well. We could go all the way back to their oldest verifiable residential address, all the way up to the onset of their ALS, and then look at what are their environmental exposures from that earliest point all the way up to them getting those first symptoms. And then we, thanks to the data center, MBRDT, that's now known as Data MB, there's actually a citizen database with all the people across New Brunswick. And we are fortunately enough able to match at a 4-to-1 ratio and get the Medicare numbers for 1,207 controls matched by age and gender all across New Brunswick that we were then able to get their postal codes and look at their environmental exposures all the way back as well. So then we can directly compare what was the environmental exposures like for someone that didn't get the disease versus someone that got the disease. What was higher? What was lower? What's going on? Simply put, because it was pretty complex, if I was trying to break it apart, we take these medical charts, we match them to the controls with the citizen database. We make sure that these controls do not have a diagnosis of motor neuron disease or ALS to make sure they're indeed considered healthy controls for the pertinence of this study. And then we match their historical postal codes from the Medicare number with actually some geospatial measurements at the postal code level that were available from Canoe, which actually has estimates all across Canada, which is pretty impressive. So we had postal codes dating to at least 2002, with many dating back to 1990. So quite a significant trajectory that we're looking at across the lifetime up to when the disease occurs. If you're interested in all the itty-gritty details, I suggest this paper that was recently published in Environmental Research. I believe it should be free access, if I'm not mistaken. I'm pretty sure you want to make sure that was the case. There's also my doctoral thesis that I'm able to talk about some stuff that usually doesn't fit in a publication about what we should do as a result of these results. As it comes to the findings, so kind of the big reveal, what was the air pollutant that was most associated with ALS? Well, interesting enough, NO2 was not. It was actually SO2, which is actually kind of had a hunch for. The reason I so badly want to look at it, it kind of relates to all the hypotheses that those patients had. They all kind of had a base where there was a potential mining combustion. Those release a lot of SO2 emissions. So it was interesting to see that objectively speaking, this kind of supports it. And for every 1 part per billion increase in annual exposure to SO2, which is a pretty small measure, 1 particle per billion particles, the odds of being diagnosed with ALS increased by 4.4 times. Yes, you heard that right. When you get odds ratios like that, you begin to wonder, did I do something wrong? Well, one thing to note is that, however, we should adjust to an interquartile range. So for someone who's on the 25th percentile of exposure all the way to the 75th percentile of exposure, so the average New Brunswicker, what levels of SO2 exposure are they actually being exposed to? For ambient levels, obviously they're way higher if you're like right next to an industry, is usually 0.14 parts per billion on average. So adjusting for that number, the odds of ALS still increase by 1.23 times per 0.14 part per billion increase in SO2 exposure. And this relation is still significant even adjusting for NO2. So it really looks like this SO2, it's like directly responsible. In New Brunswick, the main sources of SO2 emissions, going back to the hypothesis of our patients, according to Environmental and Climate Change Canada reports, would be power generation, manufacturing, and mining industries. Power generation mostly because of combustion as well as coal burning. The odd ratios, if we look for the dose response, in comparison to a reference group at the lowest quartile, as you increase quartiles of pollution, it eventually gets significant and is increased risk of the disease. It just missed trend value, but it's a small population. What's more interesting though is even at the highest quartile of exposure, so people having 0.37 or more parts per billion exposure, this is well below the threshold according to the Canadian standards of if you're under 2.0 parts per billion, in brackets, they say it's clean air quality, which these results are saying that's probably not the case. There's still some health burden occurring. There's also biological possibility between SO2 and ALS. There's been some wonderful, wonderful fundamental studies about how in rat models, SO2 causes the release of neuroinflammatory cytokines, glutamate receptor subunits getting reduced, synaptic transmission just getting out of whack. All the typical things you look for in ALS when you're looking for that laboratory side. And when we look at more cellular studies, it looks interesting that SO2, when mixed with particulate matter, even at very low doses under Canadian standards and international standards, neurodegenerative processes do begin. So these findings are done in our own backyard for those that are here in New Brunswick. And it looks like higher levels of SO2 in your residential area are linked to increased risks of ALS in New Brunswick. And this despite being more than 4 times below the threshold of what would be considered like clean air as per Canadian standards. So I find the quote by the WHO very appropriate here. The approach of there being no safe level of air pollution avoids making inferences for exposure levels before those which there is solid evidence. In other words, we don't have studies yet that exist for no air pollution existing. We only have studies for the pollution we're living in at the moment. So recommendations again is obviously there is no safe level of pollution. Realizing that as we lower, we're going to have new studies on lower levels, and the so-called accepted level of risk, it might still be causing health burden. And I still got to give, I guess, a little shout out to the progress we've made ever since the Canadian Environmental Protection Act went into effect in about 2005-6. You can see the drastic drop in sulfur dioxide emissions that happened because of that, including there was also a shutdown of one of the coal burning plants. However, recent progress is kind of stagnated in reducing these emissions, so there's still lots of work to be done. There's a need for policy shift. As we can see, even in low exposure environments, there's many studies that are suggesting there's still a risk. In fact, exposure levels as low as 2.5 for fine particulate matter is still associated with increased risk of death. And again, this, according to Canadian standards, they're usually good with up to 4.0. This study, in addition to what the literature is saying we need to continuously lower pollution levels and maybe tie industry permits that, if there's a 5-year gradual transition to get down to a level, their renewals usually happen on every 5 year. If they're not meeting those trends, that's already suggested in advance that their permit will not be renewed. It will not be a surprise to them. It will be a goal they need to continue to meet. Note that these statements, while it was in partnership with NBRDT, And we do thank CNU for the data. This should not be confounded for, the opinion or the advice of the government. This is more the results, findings, and discussion of me as a researcher myself and our team. A lot of wonderful references that you're more than welcome to explore, including the Environmental and Climate Change Canada air pollution emissions that will let you know by industry what pollutants are being released, as well as a wonderful Health Canada report that gives estimates on the cost of this pollution. All the CNU data, I definitely want to give shout out to the authors that made these data sets even exist in the first place. And with that, I do open the floor to questions and discussions, and whether it be English, French, it's up to you. I'm interested to see what we think of all this because it's quite something.
I just have to say, wow, thank you.
That's exactly what I said. Wow. Okay.
Yeah.
Wow. Thanks a lot. Like, that's so sweet. Yeah.